the honourable member for Warringah.
Thank you, Mr Deputy Speaker. The NDIS came into being just over a decade ago. It represented a real change for many Australians living with a disability. The core of the scheme's intent is this, that any Australian with a disability should be able to live a dignified life. The NDIS was envisaged as a safety net to ensure that individuals with disabilities and their families would not be left behind. The scheme assists some 660,000 Australians annually, and a further 40,000 are working in NDIS-related jobs. So this is huge. The NDIS is now a part of the support system we offer to those who need support to make sure they live in a more accessible and equal society. But the scheme is not working as well or as sustainably as it could. We have before us a chance to start righting the ship. As acknowledged by the government and many in this place, the NDIS is at risk of losing sight of what it was originally intended to do. Too many people, including those I represent in Warringah, the NDIS has become a source of frustration, pain and anger as they engage with a bureaucratic system. So redesigning the NDIS to be a cost-effective and efficient administrator that consistently delivers meaningful outcomes for those supported by it must remain our key focus in this process. I've had many constituents in Warringah contact me around their engagement with NDIS and their concerns, but also their challenges and success stories. There are also many disability services and NDIS providers in my electorate that deliver essential services and employment opportunities. My office is often in contact with those, the NDIS and their providers, with them, working through issues and helping where we can. And I am very grateful to the Minister, his staff and his office for the time they have taken to engage with my office to help constituents at time, but also in the process around this bill. He has partaken in a forum in Warringah. He came and he answered many questions, spoke to many constituents, and we hope to welcome him back soon for another forum to discuss the changes proposed in this legislation. One of the real insights and highlights I've had in my job as the independent member for Warringah is witnessing firsthand the transformative power of programs that prioritise the voices of individuals with disabilities. One of these local disability groups, Northside Enterprise, has a program called Bushlink, and it employs people with intellectual disability to carry out environmental projects focusing on bush regeneration. And I recently joined their bush regeneration team out on the Longreef headland to learn more about the program. Northside has created a program that fosters meaningful employment and community engagement whilst also maintaining and protecting our natural environment. It is a win-win-win. That is exactly at the core of what the NDIS aspires to be for all those in the disability community. There are many other wonderful organisations in Warringah, such as Pioneer Clubhouse, Cerebral Palsy Alliance and Manly House, to name just a few. They all do phenomenal work, and it's a real highlight to be able to visit them as a local MP. I've also heard, though, of the frustration from constituents who feel overwhelmed by the complexities of the NDIS and the lack of clarity surround their plans and ongoing funding. Participants need to supply constant medical reports to prove their conditions under the current system. Participants that have conditions that are clearly lifelong conditions still need to regularly prove to the NDIS the ongoing nature of their condition. It's a very costly, it's a time-consuming burden, and it's also very emotionally draining on so many participants, and I would say on the staff of the NDIA. So there have been several cases where my constituents have been unable to supply, for example, medical records or reports on time due to long wait times to see medical specialists, and alongside the often great costs involved with these appointments and changes to places. And then due to their inability to supply those medical reports within a deadline provided, participants have had their NDIS plans funding suddenly stopped or cut back. So some constituents are lucky that they had a community of family and friends that could temporarily step in, but that's a postcode lottery, and it's not how people should receive support that they need from the NDIS. At worst, unfortunately, some constituents have had to be hospitalised due to their funding being suddenly cut. So that's incredibly unsafe for participants, but what's really disappointing is that if the system was working as well as it could be, it's completely avoidable. So another example from Warringah and the frustrations that constituents have had with the current system is the lack of flexibility, and I know I've raised this with the Minister. Manly House are a wonderful service that provides specialist disability accommodation under the NDIS on the northern beaches. Their residents often need disability transport at short notice for different outings, including medical appointments. To make this easier, the residents, and unfortunately in New South Wales, due to the shortage of disability transports and accessible transport, especially public transport or taxis, residents would like to pool their funding to purchase a vehicle to make it much easier for them to plan their outings and live their lives as normally as possible. So this is an initiative from Manly House to provide that service to their residents. Third-party transport can be unreliable, often not available at short notice, and extremely expensive on the plans. One of my constituents in Mossman, so frustrated by the status in Sydney around this, Joey Sulfaro, he's found the situation so bad that he's started his own local transport service for people with disabilities. The current framework is therefore too inflexible and it doesn't allow that pooling of transport allocations. So we need more NDIA services that work for people and make their lives easier, not more difficult. I've advocated for Manly House to be able to pool their resources, but unfortunately to no avail. So I note the Minister is here and I will renew my request for that flexibility to be allowed for transport allocations. That's the sort of issue that needs common sense approach to be applied, because ultimately there will be savings for government as well and for the program as a whole. So the legislation before the House is very much welcome. The NDIS review has put into perspective the current state of the scheme and made many recommendations for how to right the ship and ensure it's more sustainable and fit for purpose and true to its original intent. The review has also shed light on the operational culture that prioritises the wants of providers over the needs of participants. In short, some people were making a lot of money from the NDIS, whilst people with disabilities were often missing out. It revealed an overly bureaucratic and convoluted structure that served to disenfranchise and alienate individuals and their families. The review has made multiple recommendations, the core of which would be, if implemented, wholesale changes to the way people are assessed for support and the way their funding is then provided. The bill before us lays the foundation for implementing the review's recommendations. It also lays out the operational changes needed to make the scheme sustainable and fit for purpose in the years ahead. This is part of the change that will alarm people the most. It's a fear of cuts and rollbacks. And so it's very important that a good, clear communication and engagement is rolled out by the Minister and the NDIA and the Department to ensure participants understand and are taken on the journey. I do not believe that it's the government intent to do cuts and rollbacks. In fact, the Minister has been very clear in saying that they're not looking to knock people off the scheme. They're looking to build efficiencies and sustainability in the scheme, and I very much welcome that. The cost of the NDIS has been rapidly increasing. Without modification, it's estimated the NDIS will cost up to $100 billion per year by 2032. That is just not I don't think sustainable, and it must be sensibly managed. So how now the details of the bill and what it's going to do. Broadly, the key changes of the bill that the bill focuses on are how people access the scheme and how the plans are created, and then how participants can then spend funds allocated to them, Of course, how the agency can step in if they have concerns funds are not being spent effectively. And finally, the powers of the quality of the Safeguards Commission. The first main change to spell out is how people will be assessed to enter the scheme. It will not be through a needs-based assessment. This assessment will, it will now be through a needs-based assessment, to be very clear. This assessment will then form the basis for the overall budget or plan a participant will receive, rather than the current system where items are basically added line by line, and we end up with a very inequitable system where people with similar disabilities have vastly different plan allocations for no real apparent reason, and it becomes a bit of a postcode lottery as well. So then that needs-based assessment will form the basis for the overall budget or plan a participant will receive. And for further clarity, we still need some clarity around how needs assessments will be done and who will undertake them. Many in the disability community are unsettled by the lack of clarity and detail around this needs assessment. The NDIS review recommended that such assessments must be done by an appropriate health professional or social worker. And the Minister has acknowledged that the needs assessment will look at your support needs as a whole. Near universal feedback from the disability community is concerned that needs assessment will not be genuinely co-designed with a variety of input from those with a range of disabilities. So this is a really key concern. The government does not yet have the trust of the community on this front. It needs to be earned. And it feeds into the wider issue at hand. The second main change that the bill relies on, some would say excessively, are on rules and determinations left for another day, often to the Minister. Whilst this will no doubt allow for a more flexible and responsive system to evolve than is currently the case over time, it's impossible to really quantify the changes without further information or clarity from the government, and this leads to great concerns by participants. And finally, it remains unclear what will be funded federally and what will be provided by the states and territories. It's another key change. State and territory governments do not appear willing to take on the responsibilities that they will need to under this refurbished scheme. The lack of clarity remains concerning, and states do need to make sure that they are full and active participants in this scheme to make it work properly. If I look at the transport sector and the provision of disability transport as an example, we know this is where there is a responsibility from state governments, and they have not been fulfilling that responsibility adequately to date. So again, transparency is absolutely needed here for the community to have confidence in the government's intentions in respect to the NDIS. Finally, I note that there's been a number of discussions around amendments and further negotiations and discussions with the Minister around possible amendments that will come from the crossbench, very much led by the member for Kooyong, and so I look forward to the consideration in detail process that will follow. But finally, I have to say it is so important for the government to get this right. It is an incredible legacy, the NDIS scheme, but we need to make sure it works and it delivers as intended. There is more to do to improve this bill, and I hope the Minister listens to the constructive amendments that are going to be put forward. I thank the government and the Minister for his engagement today. There's more to do on this bill. It's only the start, and there is going to be a long process of communication and engagement with the community to ensure the changes that are brought about by this bill are brought in as smoothly and as effectively as possible for the participants and the workforce impacted by it. Thank you.